30. Has everybody allowed in? Sharani?
Yes, sir. Yeah, yes, sir. Shall we start, sir? No?
Yeah.
Yeah. Greetings, everyone, and welcome to today's session. I'm Pallavi Rajesh Nayak, a master student in dietetics and applied nutrition at MAHE, Manipal, currently pursuing my internship at PSPH with the Manipal Health Literacy Unit. I'm thrilled to welcome everyone to the 18th International Health Literacy webinar hosted by the Manipal Health Literacy Unit. This session is tailored for healthcare providers, researchers, policymakers, industry professionals, academics, and the public aiming to boost health literacy for a brighter, healthier future. Before introducing our webinar speaker for the day, I have a brief request for all participants. Please mute your cell phones and microphones to minimize any background noise. You can post any questions in the chat box during the session. We'll address a few selected questions considering the time limitations. Thank you. In today's webinar, on the occasion of World Cancer Day, we will hear experts' insights on cancer literacy empowering individuals. Ladies and gentlemen, please allow me to introduce you to our esteemed speaker for the day, Dr. Cherian Varghese. Dr. Cherian Varghese is a public health expert, epidemiologist, and global health leader with extensive experience in chronic disease prevention, non-communicable disease management, and cancer control. He is currently a professor and director of the Prasanna School of Public Health at Manipal Academy of Higher Education, India. Previously, he had senior roles at the World Health Organization across the country, regional and headquarters levels, where he led key initiatives including the WHO Hearts Package, WHO PEN for primary care, global diabetes and childhood cancer programs, and the cervical cancer elimination initiative. At WHO's Southeast Asia Regional Office, he launched See Hearts, expanding protocol-based NCD management for 100 million people. Dr. Varghese holds an MBBS, MD in radiation oncology, MPhil from the University of Cambridge, and PhD in epidemiology. He has received multiple awards, including the Regional Directors Award for Excellence, WHO Zero 2023, and has published extensively in leading journals like The Lancet and BMJ. Over to you, sir.
Thank you, everyone. Greetings of the day. And it is good to start the health literacy session today using the topic cancer literacy, empowering individuals. Health literacy is much broader. It covers various areas, but cancer being a unique disease, I think literacy about cancer is critical for empowering individuals. Now, let me start with a short video for us to get into the thought of cancer.
Raju, your shoes are outside. I've already polished them. Don't forget, your tiffin is in the kitchen.
Milk.
Babuji, your glasses are in the cupboard.
Let's go, Babuji. It's getting late.
But my glasses?
Remember, nobody can replace you. While you look after your family, spare some time for yourself.
Be aware of these cervical cancer symptoms. If you notice bleeding after intercourse, between two periods, or after menopause, consult your doctor immediately. Remember, cervical cancer is curable if detected early and treated promptly.
So that is a curtain raiser. This video was made when I was working in cancer at the WHO many years back for the Government of India's cancer program. It has touched many people because that is what is happening. We always think of cancer happening to someone else, and we are not sort of taking it seriously to understand that we have to look after ourselves. So getting back to the theme of the day, it is united by unique. It is a wordplay, but what it essentially says is that it's a unique experience. Cancer when it happens to people, even though we call people with cancer, for each person, each family, each society, it is a unique experience because everyone's needs are unique, their perspectives are unique, and they all have a unique story to tell. So that is why this particular theme is chosen for this day. Every experience is unique. Not only every disease, every experience is unique. But then we have to bring those unique experiences together into the world where the needs of people and communities are at the center of the health system. I think one of the key message is to make cancer in such a way that people affected by cancer are at the center. It is not doctors, hospitals, or experts who are at the center. It is those affected by the disease, and their family should be at the center of a cancer program. So moving from health literacy to cancer literacy, billboards are quite common in the US. So I remember that in very early days, what I read is that when the US wanted to change the approach towards cancer, they put up a billboard which said that, do you know there are enough people cured of cancer to fill an Olympic stadium? That is important. You know why? Because cancer is unnecessarily taken as a death sentence. It is not. So that is why the cancer literacy is important. It is important for people to access, understand, appraise, and use information on cancer and to know how to prevent and promote health, prevent cancer and promote health, and also to experience more about what cancer does to people. Most importantly, a lot of misconceptions are there about cancer. I think in our part of the world, it is still very common. Look at this billboard, warning to cancer. We are going to beat this disease together. Now, I know most of the audience may be medical, but in the interest of a larger audience, let me start by saying, what is cancer? Cancer is when abnormal cells divide in an uncontrolled way. A cell becomes slightly abnormal, and instead of dividing into 2 and then into 4, it divides into 18 and then 72, and then it is uncontrolled multiplication. There are only two parts of the body where cancer cannot come, which is hair and nails. Why? Because they are dead cells. Does it pain when we cut our nail? No. That is because it's a dead tissue that we cut. All living cells in principle can get cancer. In the human body, almost all organs can get cancer, but organs like heart are much less to be susceptible to cancer. So again, the misconception is that all cancer is the same. It is not. Cancer itself is about 200 types of cancer are there. And then we can say, depending on where it is originating cancer of the mouth or breast or stomach or skin or something like that. Or we can classify cancer depending on the type of cell. We have different type of cells in our body. So epithelial cells, muscle cells, blood cells, lymphatic cells, neural cells. So that is why you hear the term that is a carcinoma, that is a sarcoma, that is a leukemia, that is a lymphoma, that is glioblastoma, etc. So that is to know that what we are talking about is not one condition like tuberculosis. Okay, when we say cancer, it is a group of diseases, and even then there are subgroups. What is the global situation? Globally, cancer is the second leading cause of death after cardiovascular disease, but in some European countries, it is already the leading cause of death. Cardiovascular disease has gone down, and there are estimated 9.8 million deaths in 2020, and 70% of these cancers occur in low and middle income countries. That is because 70% of the population is also in these countries. Around 1/3 of deaths from cancer are due to 5 leading behavioral and dietary risk factors. That is high body mass index, low fruit and vegetable intake, lack of physical activity, tobacco use, and alcohol use. Okay, so that is very important to remember that. The diagrams on the right side actually show incidence and mortality. Okay, so the incidence is high in high income countries. Incidence is the number of cancer cases occurring in a defined population in a defined period of time, and mortality also. So even though the occurrence of cancer is high in high income countries, the darker blue, the deeper red, that is the high mortality, is in low and middle income countries, clearly saying that the way we address cancer is inadequate. What is the situation in India? About 1.4 million cancer cases are there per annum. What is the most common cancer? Breast cancer, followed by cancer of the uterine cervix, which is womb, the mouth of the womb, then lips, oral cavity, ovary in women, lung, prostate, esophagus, colorectum, stomach, leukemia, lymphoma, like that it goes. Okay, so breast and cervix and cancers of the head and neck and lungs and esophagus forms almost more than half of all cancers. So what are the risks for cancer? Everybody has their own list, but then most important risk factors are tobacco, which is single most important. Almost 20% of cancers, 27% of cancers are due to tobacco. Do we still have a high tobacco use? Yes. Smoking is gone down a little bit, but it is still very prevalent. Newer forms of smoking are coming up, like vaping and all that. And tobacco chewing is also quite common, which causes a lot of oral cancer. And India is one of the highest incidence rates for oral cancer. High body mass index or excess body weight also is a risk factor for cancer. Alcohol consumption. Alcohol causes cancer of the mouth, cancer of the food pipe, that is esophagus, stomach, and all other places. Ultraviolet radiation, not very common for us, but for Caucasians, it is very high. And then infections, human papilloma virus, Helicobacter pylori, all these are infections that can cause cancer. And physical activity actually reduces the risk of cancer. So in simple terms, what are the ways to reduce the risk of cancer? Do not smoke or use any form of tobacco, and make your home and your workplace smoke free. Okay, it is happening, but we need to do more of that. A healthy diet, a diet which is high in fruits and vegetables, less in processed meat, less in sausages and all that which are coming into our market, actually have high risk of colon cancer. Women who breastfeed actually has reduced risk of breast cancer. There are vaccinations for hepatitis B infection and human papilloma virus infection. Too much sun is not much of an issue here, as I said, for dark-skinned people here. Reduce indoor air pollution. Air pollution is now increasingly being linked to cancer, especially lung cancer. We have to be physically active, which is to reduce cardiovascular disease as well as cancer. Alcohol intake. There is no safe limit of alcohol. So there is nothing like one glass of wine is good or something. Even one glass of wine in a woman actually increases the risk of breast cancer or other cancers in men. So we have to limit alcohol intake. And then all this has to be done as early, easy, enjoyable, everywhere and everyone. So this actually leads to the health literacy. Health literacy also has to be early, easy, enjoyable for everywhere and for everyone. Because if it is for some people at some time, and if it is the most difficult thing that we are asking them to do, health literacy or cancer literacy will not work. So again, just to reiterate, the two most important things that we should do for prevention at public health level is to reduce tobacco use as well as to promote HPV vaccination, because it is not only preventing cervical cancer, but also oropharyngeal cancer, anal cancer, penile cancer, many other cancers. So once we prevent cancers with as much as we can, of course, as age advances or there are genetic factors which we cannot do much, but preventable risk factors, as I said, are diet, alcohol, tobacco, physical activity, we can intervene something. Then the next is to detect cancers before it becomes cancer. So that is what it is called screening. So screening is not early detection. Screening is when we are apparently healthy, but a test like HPV testing or cervical pap smear actually helps you to identify whether there are changes in the cells which are likely to become cancer, and that it can be found out and prevented. So that is a misconception that every cancer can be screened and managed. It is not. It has to be a particular set of cancers like cervical cancer, oral cancer, colon cancer, where you can do screening. So just understand that there is a difference between screening and early detection. In this picture, you see such a large number of people and two orange people. So in screening, you are apparently normal people test to find these two people who may or may not have symptoms. But on the early diagnosis, you actually reach out to people who already have a symptoms. Okay, I'll come to those symptoms that are important. In screening, we have to have a total process of screening. People just do some test and say it is screening. It is not. Screening is actually testing a group of people with a test which is sensitive and specific, identifying who has got an abnormality, identifying that abnormality is confirmed as cancer or non-cancer, and then managed appropriately. Because it is very easy for us to say screening. Imagine a man who is told that there is a suspicion of cancer. It is almost like lightning hitting the person, right? So as health providers, we should be extremely careful before we do screening, because we should have the full capacity to manage anybody with screen positive. Otherwise, we should not screen even. Okay, so first do no harm. So don't just do just because of the excitement of screening. That is because, as I again reinforcing that in target population, they are apparently healthy population. So we have to be very careful. There are potential harms of screening also, because if the diagnosis may not be right, a lot of women will have unnecessary mastectomies or unnecessary surgeries will happen. So there is potential harm for CC. Common cancer signs and symptoms. Again, there is a misconception that all this is cancer. It is not. There could be a lump in the breast due to many other conditions. There could be a skin change due to many other conditions. There could be vaginal discharge due to many conditions. Cancer could be one of them. So it is only a suggestive symptom. There are lesions in the mouth, especially for people who chew tobacco. There are white patches or red patches, which are not at cancer, but they can become cancer. Then various other symptoms like persistent hoarseness. We all have persistent. I have a hoarse voice now because I had a bad cold. So that doesn't mean that I have to immediately go for a biopsy of the larynx. Okay, so hoarseness of voice, persistent in a smoker especially, then you have to be suspicious. So again, you have to take these things very carefully. Similarly, cancer of the stomach has certain symptoms, bladder, prostate, all of them have their own symptoms. Breast cancer itself, as I said, is one of the most common cancers in India. Many young women are also getting, and we have to get breast cancers in early stages. And again, all these symptoms are important in breast cancer to be aware of. Be aware and beat breast cancer. See, if you take the word beware, it means be aware. So one most important thing is to be breast aware. What are the changes in the breast, so that oneself can detect what it is. And there is a global breast cancer initiative by WHO, which is to reduce the mortality from breast cancer by 2.5% per year. Okay. Childhood cancer. This is another common, not very common, but a cancer which can be cured very easily. So we can get almost 60% of the children cured of childhood cancer. In high income countries, 80 to 90%. Our current survivals are only 30%. So this is again, the numbers are small, but we need a lot of support systems for children with cancer and their families. But this is something that we can really make a difference. Cancer of the uterine cervix is one cancer we can actually eliminate, because we know exactly that it is due to a virus which is happening in men and women and all that. But in certain people, this virus stays on in the cervix and then leads to cancer. So it is called the human papilloma virus. It affects men also. Ideally, girls and boys should be vaccinated as in high income countries, but at least girls should be vaccinated before the age of 15 years. And this is something which can substantially reduce cervical cancer. So we heard about reducing the risk of cancer. Second is how to detect cancers early. If you don't detect, what will happen? And that is the current worry that we have. So cancer has got a tendency to spread. So if it is in the mouth, it starts in the mouth, then it expands into the rest of the mouth, it goes into the lymph node, and then it goes into other parts. So that is why it is localized. Loco-regional means going beyond where it is. Distant metastasis means other parts of the body. So somebody has got a breast cancer, they can have a lesion in the brain, which is called secondaries. So in India, what happens? Only 30% of cancers are in early stages. Okay, in most cancers. In head and neck cancers in men also, it is the same. It's only about 30% of cancers. So almost 70% of cancers are detected when it is beyond the site of origin. And then what happens if 5-year survival for cancer, that is almost like cure, because after 5 years there can be recurrence, but it is very rare. 90% of patients will survive 5 years if in stage 1. But only 33% of people in stage 3. Stage 3 means it is extending into the nearby areas like lymph nodes and all that. And only 6% for stage 4 disease. So stage is single most important. If you look at the US, 1950 to 2000, in the first 25-30 years, mortality incidence ratio, which is almost like survival, has dropped from 0.4 to 0.25. But after screening, after a lot of treatment, the reduction is not much because already its cancers are in early stages. So in India, we are somewhere at the US in 1950. So we have a lot of work in getting cancers in very early stages. But sometimes why it is not happening? It is not just the problem of the person. Health literacy alone will not make the change. Health literacy is needed. Cancer literacy is needed. But think of a person who found some symptoms. They'll go to some local medical practitioner. They'll say, okay, it is okay. No, don't worry, go back. Then they'll go to some other hospital. They'll do some test and say, you come back. The person may not go back. Then they go to other systems of medicine. They will also say, we can do something. Finally, it takes a biopsy about 3-4 visits and about 6 to 8 months. And by the time this poor person who may be not in an urban area with many cancer centers nearby, it takes about 6 to 8 months to get definitive cancer treatment. I think this is something that we need to seriously address in this country and make sure that a person with cancer, suspicion of cancer, gets a definitive diagnosis and gets treated without this multiple aage-piche delays that is going on. For that, what is needed? For that, our health system should have different levels of healthcare, should have different capacities, right from primary healthcare, where prevention and early detection should be promoted at the level of district hospital, early stage cancers. This budget actually says that the district hospital daycare cancer centers are coming up, which is very good. But then we all need trained personnel to do this and standard treatment protocols to do this, because sometimes cancer treatment can be very expensive. In fact, as the stage of cancer increases, the treatment cost doubles or triples actually. In stage 1, if it is 30,000 rupees, in stage 4, it could be 200,000 rupees, 2 lakhs rupees. And the result is also poor. So there are various types of treatment. So when we started cancer, it used to be surgery, radiation, and a little bit of chemotherapy and hormone. Now a lot of targeted therapy, immunotherapy, new therapies are coming in. All this needs more studies to know whether they are really useful. What is useful for one person and one particular cancer may not be useful for everyone. So again, a lot of literacy is needed, and clinicians have to discuss with the patient the full details before starting treatment. So this is actually called shared decision making. And for shared decision making, literacy for cancer is critically important for the people so that they understand what is being asked. One of the reasons for poor cancer outcome in our part of the world is people don't complete treatment. Why do they don't complete treatment? Of course, finance is one issue, but also side effects. But side effects are there. Side effects when you undergo cancer treatment is actually a sign that your body is fighting hard. And when the medicine or the radiation is affecting the cancer part, it also has some effect on the normal part. And that is why side effects are coming. Remember, these are temporary, but you are one step closer to healing every day. There are particular groups of cancers like cancer in adolescents and young adults. This is again a group of cancers which is important because at that age there could be a lot of emotional, psychological problems, even sexual and reproductive issues come in. So we have to look at side effects in a very different manner in this group of people. Chemotherapy also causes a lot of side effects like nausea, loss of hair, and all that. This again, I think it is a fight that one has to go through, supported by the family and the caregivers, and then you have to win the fight. So chemotherapy side effects should not stop chemotherapy. There are medicines to control that, but it is certainly a race that we have to go through to come out of it. Similarly, radiation also causes skin reaction, hair loss, nausea, lots of problems like that. Hormone therapy, especially in breast cancer and testicular cancer, when we give hormone therapy, there are lots of mood changes, fatigue, and other things that comes in. Side effects can be managed, as I said, with medications, lifestyle changes, supportive care, and regular monitoring. Now, once you survive cancer, then survivorship is also important. A person who survives cancer, we should not call this person cancer patient every time. The person becomes a normal person who had cancer. So somebody had TB, somebody had appendicitis, somebody had cancer. That is the only way we should look at them. And they should be fully integrated back into the community with adequate employment opportunities, learning opportunities, everything for whatever that they have missed in their period with cancer. So thriving after treatment is also equally important. But let us be also realistic that all cancers cannot be cured. There are some cancers, especially in late stages, they might lead to death. And let's be honest about that. I just want one word on death literacy also. Death is something, the fear of death is something that really causes a lot of unnecessary treatment. So what I say is that we should have a chat scan. You know what is a chat scan? You just chat with the person, not just do CAT scans. And an honest communication. As providers, we should be able to communicate honestly with a low tech, and it is not just about technology, and realistic goals as to what can be done. Death literacy is important. Death is part of life. As people say, only two things are certain in life: taxes and death. But beyond all that, I think we should know how to approach death. And there are a lot of death cafes now where people can come and sit and talk. So that is another type of literacy that we need to look at. So let me close by saying that cancer, even though it is a complex condition, we can actually classify them as possible for primary prevention, early detection, curative treatment. And if none of them work, we can actually give good quality of life through palliative care, and we can decide, depending on which cancer it is, which is the most feasible thing to do. So cancer does not kill, but delay does. Early detection can cure cancer. Cancer control is a journey. One has to choose wisely at all levels by the person and by the provider. Let me end with another video.
I had cancer. Today, I'm going back home.
Cancer is curable if detected early and treated promptly. Watch out for these symptoms: a sore in the mouth that does not heal, hoarseness of voice, especially in those who smoke, lump in the breast or any other part of your body, bleeding after intercourse, between two periods or after menopause. In case you notice any of these symptoms, consult your doctor immediately.
Thank you very much.
Thank you,
Sreeshma,
sir,
over to
for
you.
sharing your important insights on this matter. Now, I would like to introduce our moderator for the session, Dr. Sreeshma Pavithran. Dr. Sreeshma Pavithran is an accomplished public health professional with a strong academic background and extensive experience in community medicine. She holds an MBBS degree from Hassan Institute of Medical Sciences, an MD in Community Medicine from the Karnataka Institute of Medical Sciences, and a diploma in Public Health Nutrition from the National Institute of Health and Family Welfare. Currently, she is an associate professor in the Department of Community Medicine at Manipal Tata Medical College under the Manipal Academy of Higher Education, Jamshedpur, India. Dr. Pavithran has been actively involved in academia and fieldwork, having served as a casualty medical officer at Narayana Hridayalaya and an external monitor for national immunization programs like Mission Indradhanush and the Pulse Polio Immunization Campaign. She has also contributed significantly to medical research, publishing studies on adolescent nutrition, anemia prevalence, viral hepatitis elimination, and women's health. A dedicated member of professional organizations such as the Indian Public Health Association and the Epidemiology Foundation of India. She continues to advance community health through research, education, and policy initiatives. Over to you, ma'am.
Thank you, Pallavi, for that beautiful introduction. And thank you, Usha ma'am and team for giving this opportunity. And thank you, Cherian sir, for enlightening us and taking us through a whole journey from how a cancer starts and to how it actually can impact one's own life. As rightly stated by sir, I would like to add that cancer for a medical person could be a disease, but if I take it from a community perspective, I believe it as a social and economical as well as and mental health problem. So emphasizing all this point, the health literacy to understanding it as a cancer literacy is a keen importance because as rightly sir brought it up in his point that we have a difference in the mortality rate with respect to this disease in when you compare ourselves with the Western world or the other countries. So there are few questions which we would like to discuss here. So, what do you think is the exact role of healthcare providers in providing cancer literacy? How do we start that?
Thank you. Thank you, Sreeshma. I think all healthcare providers should be, first of all, very sensitive to this condition because, as I said, any sentence, any word from a healthcare provider can have huge impact. So, one is that sort of empathy in communication. I think in healthcare, communication is a major challenge, especially in cancer. Second, I think they should be adequately informed about giving a considered opinion as to what can be done. As I have been saying, a lot of cancer patients go from pillar to post because somebody will give some opinion, somebody else will give some opinion. So a very definitive guidance on what needs to be done for a particular question is something that they should be fully aware of, and also ensure that the person is taken for a right diagnostic or therapeutic approach depending on what is needed. So healthcare providers have got a major responsibility in explaining to the person, in helping the person navigate the disease, in helping the person to take shared decisions because the person has to be in person and the family and the carers have to be part of the decision making process. So I would think in addition to literacy for the individuals, general public, healthcare providers should have substantial cancer literacy.
Okay, sir, that's really great, sir. Sir, I can see a hand raised, Sukhbir Kaur. Sir, if you have a question, you can unmute yourself and please ask. Dr. Sukhbir Kaur?
No, ma'am, no question.
Okay, I have Lakshmi Mini raised her hand. Lakshmi, can you please?
Yes, I hope I'm audible.
Yes, Lakshmi, you're audible.
Yeah, thank you so much, Manipal Hospital. And my question was like, misinformation travels faster than information. And I'm very sure that you all agree to it. Like the famous cricketer who claimed that he had cured his wife all, naturally. But that kind of information has reached millions of people. But what about the actual information, the reality, which people might have missed out? So what are the actions the medical authorities are taking to combat such misinformation from reaching the publics to avoid further danger in future?
Thank you, Lakshmi. I think you brought another critical issue. As you rightly said, misinformation travels much faster. So as people who are listening to this and also everyone who posts anything on such things should think 10 times before just posting on what comes. These days, our problem is that anything comes through WhatsApp University, we think is evidence-based medicine. So we have to be very careful about that. The World Economic Forum, which met in Davos in Switzerland recently, came up with risks to the world. And one of the first risks they're writing is misinformation and disinformation. Both are problematic. So I think there are checks and balances on social media. It is essentially social media which becomes susceptible to such misinformation campaigns. The only way to overcome will be to have correct information and endorsed by the appropriate authorities, and that also can be faked, unfortunately, to be one step ahead of the misinformation campaign. So we used to call it as infodemic. It is another epidemic like infodemic of misinformation. And these health literacy campaigns of the Manipal Health Literacy Center is one such effort in countering misinformation, but it needs everyone's engagement. Thank you.
So if you have any questions, thank you, Lakshmi. If you have any more questions, You can please raise your hands. So another thing, so you had stated the levels of healthcare providing the cancer care. So if you see right now, we in the primary level restrict ourselves with screening. And one more thing, what we have noticed is the screening just puts the patient into panic and nothing further could be done. So aren't we just doing injustice there? So how do we combat that at a national level?
I certainly agree with you, and I would certainly use the word injustice because I think we should not screen unless we have the full capacity and the resources to do that. But at the same time, a person who is approaching a health system, for example, a woman coming to a gynecology OPD for any complaint related to gynecological conditions can be offered a pap smear or an HPV testing because that is an opportunistic screening. So, or a person with chewing habits coming to a dental specialist with pain in the tooth, in addition to just repairing the tooth, the dental surgeon can certainly look into the mouth and say, look, you have an oral leukoplakia, you should stop chewing and smoking. So that sort of targeted approach towards people with symptoms or those who are approaching a health facility for a related condition is justifiable. But if you generally go around and screen without adequate capacity to know what is happening, what test is being used, what is the sensitivity, who is going to say whether the test is valid, do I have the mechanism to actually treat this person and prevent the cancer from going forward, is critical, as you are saying. Because one wrong step can either make the person die with the fear of cancer who does not have cancer, or die with cancer but not diagnosed properly. So it can go either way. So screening has to be taken extremely carefully. It is not that it should not be done. It should be done. But I think there is a certain responsibility at every step. In fact, in high-income countries, they do audit of the screening programs. They do audit of the cancer treatment programs and find out which are the steps which needs further reinforcement and checks and balances.
Yes, sir. So screening also need to be done consciously, not for the numbers.
Yeah.
Okay. So any more questions?
Pallavi is asking, have you ever come across any difference in how cancer is understood or treated across different cultures? Yes. For example, as I said, jokingly, I will say that in Bollywood movies, if somebody has to be taken out of the movie, they'll just say that person has lymphosarcoma and next day a photo of the person will be on the wall. So that used to be the culture now because cancer was equated to death. Then only when people say that, no, it is just another disease, you go through treatment, you do surgery and chemotherapy, and then you can get cured of cancer. So it is also the socio-cultural perception is affecting cancer. There are people in high-income countries, because it is so common, or in Japan, it is so common. Japan has some of the highest cancer incidence because of very old population. Sometimes there are campaigns that let us prevent the second cancer because by 90 years of age, somebody will have first cancer in any way. So there are very different ways, and most of the time it is ignorance, financial toxicity, all the mumbo jumbo magic treatments which is being offered, all that actually affects. So we need to have very clear protocols which should be communicated to the persons and their family so that they all know what is happening. We have to play it on a level playing field with adequate information. I think there is also, Pallavi, you asked a very right question. There are cultures where we'll say, I also have experience, doctor, don't say anything to the person. Huh? Hush, hush, hush. Everybody is hush, hush around the person. And this poor person actually knows what is going on. So we have to be very careful and don't fall into the trap of even misinformation, not to the public, but misinformation and disinformation to the person and to the family is also something, a cultural barrier. All this can be overcome by open communication, open, transparent communication, and truth always triumphs, as it says. Thanks, Pallavi.
Sir, okay, sir. Thank you, sir. There's another question. Whether cancer screening literacy should become a part of school education and higher education. So Shah ma'am has asked this question.
Higher education, certainly. I think even higher education in medical field and public health field also, I don't think there is enough emphasis on screening being put in. Screening was actually a high income country intervention, and people who go for these conferences will come and just say, let us do screening. But it needs, I have a slide actually as to a question, is your system ready to screen cancer? I think there should be a checklist by which we should say, do we have trained people? Do we have a test? Do we have capacity to do how many tests per day? How do we invite these people? When the test will be done? When the results will be given? What is the mechanism for follow-up? How do you treat if there is an abnormality? Who will pay for all these things? So at least the basic principles, as Dr. Usharani is highlighting, should be made aware to people. In fact, most about health awareness should start in higher secondary school itself. People should be aware of all these things these days. Otherwise, what happens is if we don't provide, again, as Sreeshma put it, they will all get it some wrong information from some wrong source, and then that can lead to cultural problems. Thank you.
So adding on to this, sir, I would like to know what is the level of health literacy, or how do we measure a level of health literacy in patients who are already having cancer? So most of the time after diagnosis of cancer, there is this hunting for different modalities of treatment, magic therapies and this. So if you try to assess their literacy level at the beginning when they are coming in contact with the healthcare system, is it possible that we can avoid this sort of situations rising?
Yes, I think as I was showing in a slide, honesty in communication. I think when healthcare provider is honest about what is the disease, what is the stage of the disease, what are the treatment possible, what is the expected survival, I think most human beings wants to hear the truth. I think when that is not said, that is when this sort of smoke screen is there. And then they say, oh, that person, this magic treatment is there, that new treatment is there going around. So I think as health providers, there is a huge responsibility to actually bring them into a nice room, give them a cup of coffee, make them sit around a table, not in one session, but in repeated sessions, make them very clear as to what is this disease, how they can fight this, what are the treatment options available, how can the system help you? Because that lack of communication, I think cancer is a big C, as they say, but I think communication is the bigger C in cancer. Communication between the provider and the person, between the family. Family members are also sometimes a part of the problem than part of the solution. They will also go hush hush and then go around the person looking for magic therapies. So this is the problem. So I think honesty across everyone, open, transparent communication is the only way to help everyone and to make sure that everybody is on the same page so that informed decisions can be made. And of course, as Sreeshma, you alluded to, for somebody with a college degree or somebody who is illiterate or somebody who comes from a particular cultural setting, it has to be titrated, because we cannot just use somebody might be able to stand the diagnosis saying that somebody has cancer, somebody might just collapse. So that has to be again thought through as to how do we communicate this. It is an art, it is not just a science.
So that means the modules of attitude and communication has to be inculcated into all healthcare professionals.
Very much, very much. And cancer can be the test case. If they can communicate about cancer, then that means they should be able to communicate about many other conditions.
Yes, sir. Truly insightful, sir. So any more questions? Pallavi, can I conclude?
Yes, ma'am. We can wind up if there are no questions.
Okay, sir, as rightly pointed out, cancer is a condition where we believe that 1/3 of cancers can be prevented, as rightly pointed out, by either vaccines or by lifestyle modifications. There's this 1/3 of cancers which can be treated if you easily detect it, right treatment is provided, right guidance is provided. Another 1/3 which we can manage with palliative care, and strongly believe we do not have a modality to treat them. We have to accept that there. So with this clear clarity on understanding and focusing on these three areas, we can have a module which can create cancer literacy. So thank you, Cherian sir, for this insightful, thoughtful, easy presentation which anybody can understand. Thank you, Usharani ma'am. Thank you, Pallavi, for the whole session.
Thank you. Thank you for the opportunity, and wishing everyone a healthy and happy day. Thank you.
Thank you, ma'am. Thank you, sir. Thank you, ma'am. The panel discussion has concluded, marking the end of this session. It has been honored to represent MHLU at such a fantastic event. I would like to extend my heartfelt gratitude to our esteemed speaker, Dr. Cherian Varghese, our moderator, Dr. Sreeshma Pavithran, faculty, staff, MAHE students, and MHLU members. I would especially like to thank Dr. Cherian Varghese, Director of the Prasanna School of Public Health, as well as the MAHE Press and Media Administration for their invaluable support. While I may not have mentioned everyone individually, I sincerely appreciate all those who have contributed both directly and indirectly to making this webinar a success. Thank you for participation and have a wonderful day ahead. Thank you.
Thank you.
Thank you.